Hello, everyone. My name is Stephanie, and I am a former midwife and lactation consultant, and I am currently an epidemiologist that works with COVID-19 vaccine confidence. And I am excited to be here with Dr. Fiona Mattatall, an OBGYN in Calgary, Alberta. And we are here to talk about COVID vaccines and reproductive health. This video is part of a three-part series. So hi, Fiona.
Hi, Stephanie. Thanks for having me.
Thanks for being here. So I'm excited to dig a little deeper on the topic of COVID-19 during pregnancy. I haven't been working in clinical care during this pandemic. I've been following the literature and the research as it emerges, but I know that's not the same as being on the front lines during this pandemic. So, Dr. Fiona, what has the last year been like for you as an OBGYN?
Well, it's been an interesting year. I think it's been a tough year for everybody in different ways. Um, it's been a hard year for patients who are pregnant. There's been a lot of questions, a lot of uncertainty. There's been, people are a little bit scared of the unknown of what to expect. And pregnancy is already filled with a lot of, as you know, unknowns and unpredictable things that can happen. But the pandemic has added to that. Um, it's been for healthcare delivery for our making sure our pregnant patients are cared for well. We want to protect our patients from the COVID virus, but also make sure we're taking good care of those patients who do contract the virus in pregnancy, and make sure we're taking care of them, but also not allowing that virus to spread to the rest of the patients. What's been interesting is we're having to make very quick changes in our care, and we had to do that very early on in the pandemic. And we're also having to keep on top of the medical information that is evolving, and new information coming out, and integrating that into helping our Canadian mums and dads to make the best decisions for their pregnancies.
Yeah, I can imagine it's been constantly changing. Even just thinking about ourselves and, the time when we were wiping down every piece of grocery that came into our house. We've learned so much over the last year plus about this virus.
Yep, so true.
One of the things I've been noticing is that um, in the conversations we're having about COVID, there's a lot of focus on severe disease and death, obviously, because those things are so terrifying. Um, uh, but they're pretty rare outcomes. And I think one of the things that's maybe gotten lost in that conversation is what COVID actually looks like for pregnant people, for people who might experience this during the course of their care. Uh, what is mild COVID like for pregnant people? What are the risks of COVID during pregnancy, whether it's severe or not?
Great question. And as you remember from when you were practicing midwifery care, is pregnancy is a tough road. I often say it's like a marathon, and you've got to sprint at the end. And through the pregnancy and through the birth, there's a lot of demand on just thinking about the lungs alone, and having good lung function so that you can breathe well and get oxygen to the baby is really important. So even with mild COVID, which are symptoms that can be like a very long, drawn out cold, it can impact your breathing and your ability to, sleep through the night, to walk, to be able to do those sorts of things. And for patients who have COVID symptoms while in labor, it is really hard, as it is to push a baby out. But when you've got reduced lung function on top of that, that makes it even harder. So there's the physical part of even mild COVID symptoms can be really tough on a pregnant person. But there's also the secondary effects of having this infection. And those are things like having to isolate and being away from family and support, can be very, very hard, and not being able to be physically in the same space as some of your loved ones who want to support you through that pregnancy and birth and postpartum. So those effects can be really hard as well. And what we're noticing is with our patients who've had COVID during the pregnancy, that even if they're feeling really good as they approach term and approach their birth of their baby, is that we are seeing that those babies don't tolerate labor as well, even if mom had a very mild course. And we are seeing that the babies are coming a little bit earlier, a little bit more stress in labor. And one interesting thing we've been collecting in Calgary is collecting information on the placentas for all of these moms. And in the cases that of patients who I've looked after, the placentas are coming back showing some abnormalities. And we're starting to see that also in the literature around the world, that even with mild COVID symptoms, babies are born a little bit earlier and needing more intervention as they come into the world.
Wow. Yeah, I imagine that's really alarming. Placentas are really, really important. And that's how babies get their food and their oxygen. And a placenta that's not in good shape can have really serious impacts on the baby's health and well-being. So that's interesting to know that that's happening even outside of serious COVID infection. Um, do we know, to what extent COVID can be more serious in pregnant people, and what are some of those more serious outcomes that people might be concerned about?
So, like you said earlier, thankfully, it's not common for patients who have COVID in pregnancy to get very ill, but we have seen changes as time has gone on and we have more experience with variants, that we are seeing more significant outcomes with pregnant patients requiring more hospitalization, um, more admissions to the intensive care unit, and so more of those horrible outcomes that we really want to avoid. So we do see those happen, and certainly healthcare teams are working so hard to protect that pregnant patient and that baby, and making sure they get through both the COVID and the pregnancy safely. So there's a lot of work trying to support those patients.
And if someone does have COVID during their labor and delivery, how does their, at least at your hospital, this could be variable from hospital to hospital, how does that make their time during labor and birth and the immediate postpartum while they're still in care? How does that look different if they have COVID?
So one part that's different is, aside from how much harder it is to go through the birth of a baby, is they would need to be wearing a mask at our center if they are COVID positive or possibly have COVID symptoms. And wearing a mask and pushing in labor is hard. I have been through that with a few patients, and it's hard. We do really try to keep the parents and baby together as long as everybody's healthy. But if for some reason the baby needs extra care through something like the neonatal intensive care unit, there can be separation of the parents from the baby. And that is really hard, because that's a time where we really want skin to skin and to optimize things like breastfeeding and chest feeding. So that can make things hard as well. One good piece of news we found out from very early on in the pandemic was that the COVID virus does not seem to spread through breast milk, but the immunity to COVID, that if the pregnant patient has been exposed to COVID, or even better, has had the vaccine, that antibodies do go into breast milk. So we do really try to support breast and chest feeding in these settings.
Great. So we know that COVID can have a huge impact. What about the vaccine? What do we know about the risks of getting this vaccine during pregnancy? Are there any risks? Do we need to be worried about it?
Great question. And that is what I spend a lot of my time the last 6 weeks in clinic talking one-on-one with patients about, is the vaccines that we have available, and what are they effective in pregnancy? Are they safe in pregnancy? So early on hopefully we have a few minutes we can talk about this, because it's a long story, but early on in the studies, pregnant people were excluded from the drug trials, which is controversial. but it is the information that we have. Starting in November and December 2020, many healthcare workers who were either pregnant or breastfeeding chose to get the vaccine. And fortunately, we have been able to collect information on those pregnancies going forward, having had the vaccine. And right now, we are just over 30,000 patients. We have information on the pregnant patient, but also on the babies and how things went in those pregnancies. And that is out of what's called VSafe, and that's data that is available online. People can look up. And what was found out of that study was that we did not see any increase in risk from vaccine in terms of pregnancy outcomes that we look for. So for example, in the first trimester, we would look to see if there are an increase in birth defects, and there were not an increase in birth defects. They looked at, could there be an increase in miscarriage rate? And there was not an increase in miscarriage rate. Then looking later on in the pregnancy, were there any increases in babies being too small or too large? And there weren't. Were babies born any earlier or any later because of the vaccine? And they weren't. And some of the, like we mentioned before, good news is that there's evidence that the immunity that the vaccine gives to the person who had it, so that pregnant patient, does transfer over in the newborn period, both through the blood in the placenta, but also through breast milk. So getting vaccinated in pregnancy not only protects that pregnant patient, but also the newborn. There was also some very early studies looking to see if it was as effective in a pregnant person as a non-pregnant person, and the vaccine is as effective in both settings, which was really good information to find out.
That is really good information, especially because we do know that pregnancy is a state of immunocompromise. So, that's really reassuring.
Mhm.
So, I've heard multiple accounts of people who report having been told by their healthcare providers not to get vaccinated while pregnant. This is kind of confusing because we generally trust our healthcare providers to advise us, but this advice is different from what we're hearing here. So, why do you think some providers are advising against vaccines during pregnancy?
I think there's probably a couple of reasons for this. I think our default is, especially in pregnancy, to be very cautious and not be giving information that is not well seen in science and well studied. One thing that's challenging in the setting of this pandemic is that the information is changing very quickly. And so, for a practitioner like myself who concentrates on pregnancy care, part of my job is to keep on top of the information as it comes out daily and weekly. For somebody who maybe is not got a focus on pregnancy care and they are looking after a number of different healthcare concerns for many different types of patients, they may not be able to stay on top of the information as quickly. And so I think they, on one hand, err on the side of caution, which I think is a reasonable thing to do in pregnancy, but maybe is the information that they have at their hands is maybe a few months old, and so not up to date in terms of the this pandemic.
That makes sense. So ultimately, getting vaccinated is each person's own decision.
Mhm.
So when pregnant people are weighing the risks and benefits of vaccination, what kinds of things should they be considering?
So, and I very much agree with you. Every decision a person makes in terms of medication, surgery is their decision to make, and I think our job is to help support people with information to help them make the best decision for themselves, and in this setting for them, their baby and their family as well. I think the main things whenever I'm considering any medical intervention is looking at the pros and cons. So with the vaccine, in terms of the pros, is it safe? Is it effective? And in terms of cons, is what is the alternative to vaccination and what is the risk of acquiring the condition that the vaccine would have prevented? So in this case, we're looking at what are the possible harms with acquiring this COVID infection in pregnancy versus what are the potential harms of the vaccine. And when you look at all of that data, it is without question, where we're sitting here in June 2021, that the scales are tipped to choose vaccination, whether you're planning pregnancy, are pregnant or have even missed that opportunity and are breast or chest feeding.
Great. This has been so fantastic. Thank you so much for sharing your knowledge. If people are looking for more information, what would you recommend as a reliable source to learn more about COVID vaccines and pregnancy?
So in Canada, one of our great resources is the SOGC, or Society of Obstetricians and Gynecologists of Canada, and they have a website dedicated to COVID and the COVID vaccine in pregnancy. The Government of Canada also have, through their health department, good information online as well. And I think also, if you have more specific questions to your condition, visit with your physician or midwife who is caring for you in the pregnancy.
Great. Thank you so much.
You're welcome.